Hi, my name's Alicia, and I am here to do a head-to-toe assessment on you. Can you state your name and date of birth?
Megan Reinhardt, 12/23/96.
Can you tell me who the president is?
Donald Trump,
Can you tell me what year it is?
2025.
And can you tell me where you are?
Washtenaw Community College.
Okay. Megan is a well-developed 22-year-old female, well-nourished, no acute distress. Her speech is clear and coherent in A&O times 4. I'm going to wash my hands, and we're going to start off by doing a couple strength tests. Can you shrug your shoulders? Can you push against my hand? Can you push against my other hand? Can you push against my hand? Wrong way. Can you push against my hand? All right, can you hold your arms up? Can you push? Can you push? All right. Can you push? Can you push? And push like gas pedal and push against the hands. All right. Muscle strength is 5 on a 5 out of 10 scale. It is symmetrical, strong, and equally bilateral on upper and lower extremities. All right, now we're going to test your sensation. I'm going to touch each part of your body, in your arms and your legs, with something sharp and something soft. And so I just want you to tell me what you feel. Can you close your eyes?
Mm-hmm.
All right, and then let me know what you feel.
Sharp. Soft. Sharp. Soft. Sharp. Soft.
All right.
Sharp. Soft. Sharp. Soft.
All right. We've tested your sensation. Patient sensation is symmetrical, intact bilaterally in upper and lower extremities. All right, so now we are going to test your reflexes. I'm going to borrow your arm, and I'll have you loosen your hand. All right. And, all right.
Which one is that?
That is your bicep. And then we're going to flip over, and I'm going to support your arm. And that is your tricep.
Mm-hmm.
And then we're going to hold your wrist. And I'm going to hit. There we go. And that is your plantar reflex. So we just tested, or your radial reflexes. So we just tested C5, C6, C7, C8, C5, and C6 again. Okay, now we're going to test your plantar reflex, which is your L2 and your L4, and your ankle, which is S1. So I'm going to tap your knee, and then we're going to tap the inside of your ankle. All right. And then we are going to test the bottom of your foot for your sacral nerve. We're going to do the Bushinski, which is a backward 7 on the bottom of your foot. All right. What? Oh, and there was no reaction to the Bushinski in the bottom of the foot. All right, so now we're going to test your gait. I'm going to have you just go ahead and stand up, and I'm going to have you walk across the room, and then I want you to walk on your heels backwards and on your tippy toes forward. All right. All right, patient station is normal, and their gait is normal. Okay, now I'm going to test and check your head for any sores or lesions, and we have none. Then we are going to look in your ears for any excess wax or buildup. Okay, and then we are going to look at the overall appearance and make sure that the patient has good skin tone and skin color. Then I'm going to have you follow the light with my eyes. All right, we're going to do it one more time. All right, pupils are round, equal, and reactive. Then I'm going to look in your nose. All right, no nasal flaring. I'm going to have a look in your mouth. Mucous membranes are pink and moist. And I'm going to check the side of your neck. No lumps or masses. Trachea is midline. Also, with the mouth, there was no cyanosis around the mouth. There was no pursed lip breathing. Around the neck, there was no palpable carotid, no thrills. I see no jugular distension, nor accessory muscle use. So now I'm going to listen to some sounds in your neck and your lungs. What I'm going to have you do is I'm going to have you hold your breath, and I'm going to listen on each side of your neck.
Cool.
All right, go ahead and hold your breath. All right, hold your breath. Okay, and then I'm going to listen to your lungs. Stop laughing at me. Okay. When I listened to your carotid artery, I did not auscultate any carotid irregularity. Listening to your lungs, when looking at you, there was no visual, no irregular abnormalities, no barreled chest, no scoliosis, no shortness of breath, no retractions, no tripoding. When listening to your lungs, there were no abnormal lung sounds, vibrations in either anterior or posterior lung fields. All right, so now we're going to listen to your lateral lung fields. I'm going to listen to both lobes on your left and the 3 lobes on your right.
Okay.
All right. Okay, lungs are clear bilaterally, 0 wheezing, crackles, or rhonchi. Okay, so now we're going to listen to some heart sounds. We would normally start off by palpating, and we would palpate your aortic, pulmonic, Erb's point, tricuspid, and mitral valve. But for this video, I'm just going to take a listen. Okay, so to listen to the apical pulse, you would use the left midclavicular line in the 5th intercostal space. I palpated no thrills over the cardiac valvular areas. I would also take heart sounds using the bell and diaphragm over the valvular areas and Erb's point in both sitting, lying positions. If hard time hearing from chest due to breast tissue, put patient in a left lateral position. Patient had normal S1 and S2 heart sounds, heart regular, rate and rhythm, no murmurs, gallops, rubs, no S3 or S4 heard. Okay, so now I'm going to check your capillary refills and check for edema. Can I see your fingers? Okay. Okay. There's normal cap refill, less than 2 seconds on right and left hand, and it is brisk. Edema in lower and upper extremity, or no edema in lower and upper extremities. Skin returns to normal immediately. I do not observe any signs of upper or lower hand or feet edema. Now we are going to listen to your pulses. We're going to do your brachial, which is in your upper arm, your wrist, which is your radial, and your femoral artery, which would be in your upper legs, but we will not be doing that in this video. All right. Okay. Brachial, radial, femoral, patella, and post-tibula and dorsal pedal pulses were palpated and symmetrical, and they were 3+ in quality bilaterally throughout. All right, so now we're going to inspect your abdomen. First, I'm going to listen, and then I'm going to palpate, and then I'm going to percuss. Okay. Abdomen is concave without visual scarring, slight vibration, non-existing or non-excessive active bowels across abdomen, no bruises or engorgement of veins around the umbilicus. I hear normal active bowel sounds in all 4 quadrants. I do not hear any burst or abnormal blood turbulent over the aorta, renal arteries, iliac arteries, or femoral arteries. During palpation, I do not palpate any areas of the abdomen which are tender or distended. No masses noted when palpating. When percussing, I noted normal bowel intonation when performing percussion of the abdomen. And that completes our assessment.